As a lot of you know, I moved to Utah a couple of years ago, and it's a super dry state. I do a lot of mountain biking, hiking, and skiing, and when I do those activities in this dry of a climate, it's crucial to avoid getting dehydrated, and that's where Element comes in. What a lot of people don't realize is that healthy hydration isn't just about drinking water, it's about replacing water and electrolytes, which makes sense because you lose both water and sodium when you sweat. So both need to be replaced to prevent muscle cramps, headaches, and energy dips. Unfortunately, the typical solutions on the market, Gatorade, other sports drinks, and low-quality electrolyte packs, are often loaded with sugar and a lot of artificial colors and flavors. This is why I've become a huge fan of Element. Element is a zero-sugar electrolyte solution for people who want to stay hydrated but don't want to put a lot of junk in their bodies. It comes in super convenient individual packs that you just mix into your water bottle and you're good to go. No sugar or artificial junk, just electrolytes and great taste. Element was formulated by my good friend and former research biochemist Rob Wolf to provide the optimal ratios of sodium, potassium, and magnesium for health, performance, and energy. They also did a great job with the flavors. My favorites are orange salt and watermelon salt, but they have several other great flavors that are worth trying too. I've turned most of my friends and family onto Element and they love it, so I wanted to give you the chance to try it too. For a limited time, the folks at Element are offering a free Element sample pack, which comes with 8 packets of Element, one of each flavor they sell. All you have to do is cover the cost of shipping, which is $5 for US customers and location dependent for international customers. Element has been an absolute game changer for me and so many people I know. I put one in my water bottle virtually every day and never exercise or do anything active without it. I hope you get as much benefit from it as I do. Just go to drinkelement.com/Kresser. That's DRINKLMNT.com/Kresser to claim your free Element sample pack. You only cover the cost of shipping. Again, that's drinkelement.com/Kresser. DRINKLMNT.com/Kresser. Hey everybody, Chris Kresser. Welcome to another episode of Revolution Health Radio. This week, I'm excited to welcome Dr. Jordan Feingold as my guest. Jordan is a resident physician in psychiatry, a researcher and positive psychology practitioner and teacher, working to bring the work of self-actualization and transcendence to patients and clinicians everywhere. So if you remember my previous podcast with psychologist Scott Barry Kaufman, where we talked about self-actualization and transcendence, Scott briefly mentioned Dr. Feingold to me on that podcast and the work that she was doing implementing these tools and practices and concepts in the healthcare professional audience. And so I was really excited to connect with her because, as many of you know, I'm not in addition to being a clinician myself, I've also trained functional medicine clinicians since 2016. And I'm very well aware of the need for this kind of work in that audience. A lot of us as clinicians suffer from burnout. We work really long hours, unrealistic schedules and in structures and environments that are really not conducive to our own health or our patients' health. And I think it's really crucial for us to find ways to cultivate more resilience, more self-awareness, self-actualization, and even transcendence. So I was really excited to connect with Jordan and talk to her about her work. As an undergrad, she attended University of Pennsylvania and then also went on to get a master's degree in applied positive psychology at UPenn, which is where she originally got exposed to positive psychology, took Scott Barry Kaufman's class. Then she received her MD and her Master of Science in Clinical Research from the Icahn School of Medicine in Mount Sinai. And she has since then founded ThriveRx, which is an online well-being course for clinicians, which we'll talk a little bit about at the end of the show, and Peers, Practice Enhancement, Engagement, Resilience, and Support, which is a medical trainee well-being curriculum. And she teaches around the world on positive medicine. She's also writing a book on post-traumatic growth and post-pandemic growth with Scott Barry Kaufman, which we talk a little bit about. So even though Dr. Feingold's work is oriented towards clinicians. She had her REVAMP model of physician well-being. REVAMP is an acronym. 100% applies to all of us, to everybody. It's a way of looking at health and well-being and what the ingredients are, so to speak, in health and well-being. So much of medicine is focused on disease and dysfunction, and yet we know that health is far more than just the absence of disease or symptoms. And so in this show, I talk with Jordan about what health really is, what constitutes health. How do we explicitly work toward more health and well-being instead of it being just this vague concept? And that's where the REVAMP acronym comes in. It provides a kind of roadmap or a guide that we can use to intentionally cultivate more health and well-being in our lives. And I think that's always important, but it's particularly important now in this pandemic era that we're living in. So hope you enjoy this conversation as much as I did. Let's dive in. Jordan, welcome to the show. It's a pleasure to have you.
Thank you so much. I am very honored to be here.
So why don't you start by telling us a little bit about your background, what you're up to, and how you got interested in this concept of medical and physician well-being and positive psychology applied in medicine.
Sure, happy to. So my journey started as a young kid in high school growing up. I discovered pretty quickly in my high school biology class that I was fascinated with the human body, and it was specifically the digestive tract that totally turned me on to a career in medicine. And I just remember being fascinated by the story that my high school biology teacher told of her bagel being digested throughout the body and all of the different proteins and enzymes that were working on the bagel with cream cheese, and how, it was better to have more nutritious for our bodies to have the carbohydrates with the protein of cream cheese, even though it was more calories to help the body to actually digest the food. So that is what hooked me into human physiology. And I went to college at the University of Pennsylvania in Philly, which just fortuitously happens to be the birthplace of the formal field of positive psychology. And I had the pleasure of taking Scott Barry Kaufman's positive psychology course as a senior. And before that, I sang in a college a cappella group at Penn called Off the Beat. And we were hired every year by the Masters of Applied Positive Psychology program for the last day of their class to come into the classroom and teach the master's students a piece of a cappella music. And this experience for me was like a peak experience of my life that I got to repeat every year, my freshman through senior years of teaching these students a piece of music. And through this, singing opportunity, this gig we did every year, I really dipped my toes in the water of positive psychology and understanding what that was. And it was in that performance my junior year when it really struck me that I need to pursue this. I need to pursue this as an academic focus. I really want to learn more about positive psychology in a formal way, because it wasn't until I discovered what positive psychology was, really understanding that well-being is more than just the absence of that which afflicts us, that I realized that medicine, the field that I had dreamt of going into, I was pre-med, was so focused on disease and dysfunction. So that sort of crystallizing experience of being immersed in the MAP program through the singing thing led me to apply for myself and ultimately go to MAP, do the 1-year Master's of Applied Positive Psychology program at Penn before I went to medical school. So now I've since graduated from medical school and I am a resident physician in my intern year in psychiatry in New York City. And I'm applying positive psychology and now what I call positive medicine in what I do with patients and how I teach medical students and trainees and clinicians really every single day.
That's a fascinating experience. And I really couldn't agree with you more. It's always struck me that there's no real definition of health in the conventional medical paradigm. It's as you know, having just gone through this, you go to medical school, you're mostly studying a list of diseases and the ways to treat those diseases, and there's very little discussion about what constitutes health and well-being. As you said, it's not simply the absence of symptoms or disease, but it's clearly the presence of something else. And of course, there are people who have symptoms and have diseases, and yet we would unequivocally describe as being incredibly healthy and well. And then there are people, on the other hand, who have no clear symptoms or disease, and who most people would assess as being unhealthy and unwell. So it's such a fascinating thing to explore, because beyond what I just said, I don't think there are, I think within the kind of general consciousness, there aren't clearly defined concepts here.
Totally. And that was exactly what I was trying to understand when I went through the MAT program, and ultimately dedicated my capstone work to at the end of the program, was, understanding that illness is so clearly defined, just as you've said, and so is burnout. I became really fascinated by how do we promote well-being for patients if the doctors and the clinicians who are sort of the conduits of their healthcare are so ill themselves and lacking well-being themselves. And I started to really study burnout among physicians. And it was so clear to me that, since the 1980s, and the concept first came into the literature in the 70s, that burnout was this really well-defined phenomenon of emotional exhaustion, depersonalization, and a low sense of personal accomplishment related to the work that we're doing, particularly in the health services industry. And there was just so much out there. And, since 2016, it's even exploded so much more, and especially during COVID, and everyone's talking about burnout now in every industry. But there was no unifying concept of well-being. And so I scoured the literature and was looking at different concepts from Eastern philosophy and Western philosophy dating back to the 1950s with Marie Jahoda. I was looking at sociological definitions of well-being, and ultimately came up with one that I, most proximally is based on Marty Seligman's work, the father of positive psychology, but iterates on it, that I define as revamp, which I love because I love acronyms because they're sticky. And it's an acronym and a call to action for physicians, and really for everyone, to really revamp the way that we're thinking about our own well-being, with 6 core ingredients. And those ingredients are what we know really comprise, none are sufficient for well-being, but each of them sort of synergistically, and we pursue them all for their own sake, but they're all sort of required for well-being. And it's helpful to have a model, because, well-being is not just something, we don't just say like, oh, let's just go enhance our well-being, but we can say, let's go work on our relationship. So that's the first, that's the R of revamp. And engagement, vitality, accomplishment, meaning, and positive emotions are sort of these 6 core ingredients. And you may have heard of PERMA, and I think it's been discussed on the show, the PERMA model, and revamp has vitality at the center of it, and I think starts with the relationships. And if you go no further than relationships, I think we get pretty far when it comes to well-being.
So how is, this is perhaps a leading question or a rhetorical question in some ways, but if we use the revamp model as the guide, and we look at the way that conventional medicine is designed and structured now, and how is that falling short, just starting with relationship?
Yeah. So as you talk about a ton in your work and on the show, the medical model is all about treating disease and dysfunction, and really, even for doctors, traditionally, it's like always just putting the patient first before everything that we do. There's sort of this like stigma for what we can't see. So this idea, my mentor Doug Drossman calls this illness without disease. So all of these functional disorders, or what I focus on, disorders of gut-brain interaction, that don't have a lab value or an imaging test to validate them, when we're faced with these things as traditionally trained medical doctors, we often get really burned out because we don't know how to really deal or treat these things that are illness without disease, that, that really satisfying, oh yes, this is clearly pancreatitis, or oh yes, this is, this is inflammatory bowel disease. So those in between conditions, those functional things, like IBS and functional dyspepsia, even mental illness, which obviously I'm really interested in and focusing on, it can lead to a lot of dissatisfaction in the system, because our job as this, in the medical model, is to identify the causal agent and be rid of it.
Mm-hmm.
And
Mm-hmm.
I think that can really, that really interferes, especially in these cases that are not so clear cut. It's not just pancreatitis, it's not just inflammation, that we end up seeing the patient as this obstacle or this barrier or this difficult person that is almost preventing us from doing our jobs, rather than leaning into the power of the relationship as the content for healing.
Mm-hmm. Yeah, I think that's right. And it really, it strikes me that, I mean, that I'm a geek when it comes to data and science. I love that aspect of medicine, and yet I think that medicine has really suffered. The art of medicine has really suffered in the past, let's say, 50 years, as it has the pendulum dramatically shifted toward a more quantitative approach, which is kind of what you're talking about, where if we can't quantify something and measure it, and if we don't see a lab value increase or decrease, or we're not able to assess it in that way, then it doesn't really exist. And I think that's such a reductive view of what medicine really is and what the potential of medicine is. And I think back to, this is kind of a cardinal example of where growing up, my dad had like seriously like Norman Rockwell painting of a doctor that like stepped out of a Norman Rockwell painting and showed up at our house. He did house calls, and he had the he had the bag, the black leather bag. And he, my dad would have him come over, and he would like, not be feeling well, and he would examine my dad, and he'd be like, you're fine, there's nothing wrong, you're just a hypochondriac or something like that, yeah. And he would leave, and that was it. And it was like, yeah, I mean, it's so hard to imagine that happening now at that kind of relationship that he built with his physician. And I used to sometimes go with him, and when he went into the office, and it was just a totally different experience than people generally have today with their primary care doctor, where, they're going into a big impersonal office, and they spend maybe 10 minutes. If you look at the statistics, somewhere between 8 and 12 minutes, and it's largely centered around figuring out what medication to prescribe, for the various symptoms or issues that someone has. And and that doctor has is seeing 25 patients that day, and has a panel of 2,500 patients, and is, doing their best to try to relate in a human way. But it's, when they're in that kind of environment, that's just like factory, it feels like a factory. It's almost impossible to focus on the R in that acronym, and the relationship being key. And is it any wonder then that doctors feel burned out? And then from the patient perspective, they feel like they're just a number, or they're just a set of lab values, or, they're not being seen and heard and understood as a whole person. And I love that you started with relationship, because, when I was in school, I did my kind of capstone work was on the placebo effect.
I wanted to talk to you about the placebo effect. Yes.
Yeah, which I started, a la Ted Kapchuk out of Harvard, I started to refer to more accurately as the self-healing effect, which I think is a much more accurate term. And then, of course, the evil twin, the nocebo effect. And when you spend some time learning about placebo and nocebo, it is impossible
to leave that experience without a deep appreciation of the power of relationship in healing, because that's really what placebo and nocebo are all about.
And nowhere in med school, of course, we learn how to listen compassionately and to be empathetic, but in no course in med school anywhere that I know of do we actually learn how to harness the power of human connection for healing, at least
Mm-hmm.
in allopathic medical schools.
No, that's such a missed opportunity. And that's, Ted Kapchuk's work is so great in that regard, because on the one hand, if you're a pharmaceutical company, the placebo is your nemesis, right?
Exactly. And in every randomized double-blind controlled study, we're trying to beat the placebo.
Right. Right. And it outperforms antidepressants in a lot of cases and lots of other medications too. So I think placebo has gotten it's almost a pejorative term in a
Right.
lot of in medicine, because it's like, oh, this is a non-effect.
Right.
But it's not a non-effect at all. It's an actual measurable effect. And so why aren't we asking the question of how to harness this self-healing ability and promote it, rather than to denigrate it and try to make it go away?
It's so funny that when I was sitting in the resident room, I'm on my internal medicine rotation right now. So I'm working in the hospital and managing the medicine floors. And these residents, I'm like an off service resident. So everyone knows I'm a psychiatry resident. And it's funny because we're sort of treated a little bit differently than the medicine residents who are there, and this is their turf and their domain.
Mm-hmm.
And they're so inspiring and they work so hard, and a lot of them are my dear friends, and they're running around, and they were joking this morning that no one has had any time to work out, but yet we're running around the hospitals. And I said, well, if you really know what the research says, you just got to give yourself credit for the laps you're doing and all the staircases you're running through while you're on shift, because really, look at your Apple Watch, you are working out. And if Aaliyah Crumb's research teaches us anything, is that we have to give ourselves credit for the things that we're doing, because our physiology will respond. So I sort of go around, even just informally, preaching all of the placebo research, because we need to harness it, not just for, if we know it, that's fantastic for us as clinicians. And then we need to tell our patients, because this is powerful stuff.
It's super powerful. I mean, I'll tell you, you probably have some of your own favorite anecdotes, but some of my favorite are the placebo surgery stuff, work that was done in Washington, where they would prepare the area, they would even do an incision, and then they would just close it back up and not even perform the surgery. And then those people would have as good or better results than people that actually had the true knee surgery. And then the one study out of Japan of people with poison ivy allergy, where they told them that they were rubbing poison ivy on one arm and then like just a benign tree, like a maple leaf or something, on the other arm. But what they did was actually the opposite of that.
Oh, I don't know this one.
Oh, this one, yeah. And people, a large percentage of people broke out in a rash on the arm that was with the maple or the benign leaf, and didn't break out in a rash on the arm that they actually rubbed the poison ivy on. And there's so many similar stories. If we know that the color of the pill, for example, has an impact on its efficacy, and they figured this out like I think there was a sleep medication in Italy where the pill was blue. I could be getting the colors wrong, and it wasn't working well. And then they figured out that the color of the national soccer team uniforms was blue, and that was sort of like a stimulating, exciting color. And they changed. It's just bizarre. It's so clear that we're missing an entire element of the equation. And as long as we continue to sort of look at this as something that needs to be overcome in order to sell more drugs, I don't think we're going to make progress that we need to make.
Totally. And back to relationships and placebo, there was a recent study a couple of years ago where similar with they were giving sham antihistamines after inducing an allergic response in patients' arms, and they just gave like unscented lotion. It wasn't actually an antihistamine, and they recorded the amount of time that it took for people to recover. And those who had doctors who were scripted to be kind and compassionate versus the cold doctor actually recovered more quickly from with the sham antihistamine from the allergen. So this is, it's hard to do, and I can't say I always do it, but when I'm with my patients, especially in the hospital, when they are seeing so many different people and people are in and out of the rooms, they're getting woken up at 5 a.m. to be stuck for blood work, which I tell my patients, I'm like, if you refuse in the morning, we can come back later and get your blood. Like we don't have to wake you up for sleeping at 5 a.m. But when I go into my patients' rooms, really just trying to get to know them beyond the slew of complex conditions that they have, and asking them, what's something that your healthcare team doesn't know about you that you want us to know, that no one has the time to ask. Because when we read about our patients and going through rounds, it's like the 53-year-old with diabetes, hypertension, COPD, asthma. We're really defining our patients and therefore seeing them as the compilation of their illness, as opposed to, and really, at the expense of the human being who's sitting in the bed and the family that they come from and the strengths that they have. And one of my just like lofty goals that should not be like such a hard lift would be to really include patients' signature strengths, even just one strength in their one-liners, so that when we're talking about them, Mrs. Johnson is a 72-year-old who is very high in her ability to love and be loved, who, has XYZ, so that we can just humanize the patients and not just talk about what's wrong with them, but begin to think a little bit about what's right with them. And through those things, I actually think we can get to more productive ways of healing.
I love that. I think it's, I've seen some of those same placebo relationship studies where they, would randomize people to a caring affect and, lots of questions and listening. And then in the other group, the physician would just come in, say a couple of words and leave the room. And it makes an enormous difference in the outcome of the treatment. So what about engage? How does that show up in the model?
Sure. So in engagement, I think it's sort of like threefold. And then I actually want to go back and say something about let me go back for a second and say, before we move on, I also think that with relationships, I always talk about with medical personnel, the relationship that we have with ourselves and the importance of self-compassion, because we don't often think about our relationship with ourselves as a relationship, but it's so important when, we're in such a high speed, high stakes environment as clinicians, and our mistakes can really actually be lethal to people, that we really learn how to cultivate our own internal dialogue. And I really love Kristin Neff's work on self-compassion. And so before moving on, I think it's really important that we just, pause and conceptualize that we need to tend to that relationship just as we tend to the relationships with our patients and our colleagues.
I agree 100%. Yeah. And that would even take it a step, or at least build on that and say, I don't think compassion for others and empathy for others, and as Kristin would attest, is really even possible without self-compassion and self-empathy.
What Kristin would also say is that it's so much easier to hold compassion for other people naturally, that we're, the advice we would give a friend, we would seldom default to ourselves unless we've really practiced it and stretched the self-compassion muscle. And yet it's the self-compassion that helps us sustain our compassion for others, that we can't sustain it until we know how to care for ourselves and talk to ourselves that way.
One of my Zen teachers, Sherry Huber, was actually really, she combined some Western psychological concepts with Zen practice and wrote a book about compassion, actually. And one of her favorite sayings, which has always stayed with me, was, if we had a friend that treated us the way we treat ourselves, we would have gotten rid of that friend a long time ago. Which is, Yeah, very true, I think, for most of us. And it's sometimes hard for us to monitor that kind of self-talk. And if we she actually did these retreats where you would write down the things that you catch yourself saying to yourself or about yourself. And then there was a little bit of like drama therapy in the set, and you would hand those parts to other people, and other people would speak those parts, and it was so much easier in that context to get angry and say, wait a second, that's not true, and, but when it's just the tape that's running in our own heads all the time, it's a lot more difficult to catch that stuff. So yeah, I think I love Kristen's work as well, and there's so many others out there that have really emphasized this, but it's, I think, just there's something about maybe human nature, or certainly the way we relate to ourselves in Western world that is makes this a pretty common experience and challenge that we face.
Totally, totally.
All right, so engagement.
So I think of engagement as this like threefold construct. So the first that comes to mind is flow. Really get this psychological experience where we are at one with what we are doing, where there's no time, there's no ability to self-scrutinize or even be dispassionate to ourselves, because we are so invested in the task at hand. Our actions and awareness are merged. And this comes from Mihai Csikszentmihalyi, who I actually found out passed away very recently. And he's the father, one of the fathers of positive psychology and this concept of flow, and wrote the seminal book on the topic in 1990, I believe. So flow is the ultimate state of engagement. And we talk to medical students and practitioners about how we can get into more flow in our workday. So much of it is the way we focus our attention and design our workday to do tasks in specific ways and not keep the phone the phone buzzing in our pocket, even if it's, related to patient care, which is actually something that I've been really struggling with, because so much in this modern day where I'm just on Epic Chat all day, in touch with social workers and in touch with all of the members of the care team, being pinged nonstop. And it's, as now I'm going through my training, I'm realizing just all of the barriers that there are to flow in the inpatient setting, and how we have to design our way out of that. So flow is one facet of how I think about engagement. The next one I mentioned briefly is character strengths. How do we use the best parts of ourselves in our work and actually bring that to the forefront? And I also think it's really an antidote to the negative internal dialogue, is how do we lead with our strengths rather than focusing on our weaknesses? And then the third is mindfulness practice, not necessarily meditating, although I think if all of our doctors meditated, and we'd have a healthier healthcare system. But really, how do we be with our experience when things are challenging and difficult, rather than so in the experience? So it's I think about this as an interesting counterpart to flow. Sometimes it's really about being with. We can't be in it because it's either too painful, or we need some outside perspective, and learning how to really be with ourselves.
Yeah, it's really interesting to hear your internal perspective on how the structure of inpatient care is at odds with engagement in certain ways. And I would say also just the the way that screens have invaded our lives in general are at odds with that, especially if you don't take any steps to rearrange those default settings on the phone. For example, every app you install, is trying to notify you, no matter how inane or irrelevant that notification might be. Like, oh, a new app was just uploaded to the App Store. Do you really need to be notified about that? Like while you're on a hike and or out to dinner with your partner or something. It's just kind of absurd in some way to me, that the assumptions that we've made about our time and how we want to spend our time, and then the almost complete lack of boundaries or sense of protectiveness around that time, where there's kind of an implicit assumption that I'm willing to be interrupted at any time for any reason, and often reasons that are not at all my reasons, that are really about somebody else's priorities and goals and not mine. And I think it's with inpatient care, the stakes are higher, and there are other variables at play there. So it's interesting to think about, like, what is essential real-time communication.
Right.
What are things that need to be communicated immediately and need a response immediately, and then what are things that could actually just be asynchronous, in the sense that they don't require immediate response. It's something you could respond to later that day or even the next day, but we're just using the synchronous tool because that's what's available, and we've just fallen into that habit.
Exactly. I think about that so much. I'm like, this is a brand new technology. This didn't exist. And I wasn't part of the system when it didn't exist. So I can't even imagine. I mean, we used to use paper charts. There was just one chart, and it lived in the patient's room, rather than, 17 different doctors inputting things to our electronic health record, which is an incredible tool. But like anything that is, really innovative, there's always a dark side to it. And, the dark side is that we're constantly, in it. I spend more time in my patients' charts than I do with my patients. And
yeah.
So, having had the luxury of studying positive psychology and learning so many of these things before my medical training, I feel like I'm almost like uniquely equipped to be with the experience as I'm going through it, rather than getting so bogged down by it. I'm almost able to bring this mindset of curiosity and saying, isn't this interesting how this is how it is, so that I'm not, it's really that mindfulness piece. It's like, I'm trying to figure out, it's such a gift to be able to go through it this way and say, what about the system would I love to change? Sort of knowing that I have to learn it from the inside in order to change it. It's kind of this like mental gymnastics that I'm doing in order to keep myself sane as I go through it. And not just sane, but like really happy and able to like have levity and joke and, do my jumping jacks in the call room and, give myself credit for exercise that day. But it just makes me wish that all clinicians, physicians, nurses, functional medicine, doctors, all of our health coaches had this knowledge going in of how the system is so, dysfunctional and needs to be changed, so that we can go through it and say, sort of identify the pieces without just being bogged down and overwhelmed by all of the change that needs to be made.
Yeah, I think that's important. And it's important to go back to first principles. Like, what is the point of this technology? And then, what are we trying to achieve? What's the outcome we're trying to achieve? And is this technology even the best way to achieve it? That's a whole nother conversation. And I think of Slack in our experience, with my company, is like, it's a synchronous chat tool. And there are certain types of communication that really require that, but there's not a lot of them. We're not like a emergency services provider, but it becomes the default in a lot of organizations. It's like, even if something doesn't require an immediate response, it's just, throw it in Slack. It's the easy thing to do. And then what that translates into is just a near constant stream of interruptions throughout the entire day, so that it's almost impossible to do any deep focused work. I talked about this Cal Newport when he was on the show. And it's just, I think it's a real problem, not just in medicine, of course, but in all of work life and just life in general at this point, is we've let some of these technologies dictate the way we work, instead of figuring out how we want to work and then making, technology serve that. So it's something we definitely struggle with, even in the functional medicine clinical setting, like how to best use these tools to serve patients and serve the clinicians.
Right.
All right.
Yeah. So we could go. Yeah, we
Yeah,
that's a whole
I want to
conversation.
get to I want to get through
Me
the
too.
acronym. So we're on V.
So vitality is all about what makes us feel alive and really able to do what we need to do on a daily basis with vigor. So, it's amazing how many clinicians are really poor sleepers, poor eaters. They don't do any physical activity. And what the research shows is when we don't do these things, when we are, drinking a ton of alcohol or smoking cigarettes, like we don't counsel our patients on these behaviors because we don't want to feel like hypocrites. And there's a huge cognitive dissonance in telling someone to do something that we are not doing ourselves. So it's really helping, us find sustainable behaviors and, using things like motivational interviewing for clinicians to and smart goal setting to figure out what are small changes that we can make so that we can be doing so we can live more in line with what we need to help our patients do. So it's really like the basic stuff. And in the vitality module that I always teach, I talk about, this is where I talk about placebo and the connection between the mind and the body, the mind and the gut, and all of these reciprocal interactions that, thanks to the legacy of Descartes in the 17th century, we've separated the mind and the body, but really we need to reintegrate them because they're so inextricably linked and we really can't move one without moving the other.
Great. And I just want to remind everyone who's listening, we have, of course, a lot of clinicians and practitioners and health professionals in the audience, but this acronym and the principles apply to everybody.
Yeah.
Relationships, engagement, vitality, all critical ingredients to health and well-being. So what is A?
A is accomplishment. So it's this sense that we are working toward our goals and we are efficacious and have, an internal locus of control. What we do actually matters. And at the core of burnout is this low sense of personal accomplishment. We just lose sight of what we've been doing. We adapt to our own success and it just doesn't even feel like anything anymore. And accomplishment in the revamp model just helps us reorient to this. So I think there's this tension that, in order to like success feels like a zero-sum game. Like in order for me to further my own success, like someone else has to lose. And that gets reinforced in our society in lots of different arenas, and especially for like people in Western medicine who have like gone through, for doctors who have like gone through medical school and pre-med and have had residency, and like you've always had to sort of like put yourself above someone else, and it fosters this like crazy mindset that like I'm going into this helping profession to help other people, and yet I have to like put myself above my colleagues. And it's really it's actually just totally bogus, because what we know is that, our personal goals and pro-social goals don't need to be zero sum, that, we do best when we're working on teams and helping each other succeed. So the accomplishment is really, it's like two main constructs that I love. It's grit, which is passion and perseverance for our long-term goals, which is Angela Duckworth and many other people study this, and otherishness, which I first read about from Adam Grant and one of his colleagues and my colleagues, Reb Rebely, who talk about this idea of helping ourselves help others and helping others in ways that are sustainable to us. So I merge these concepts and I call it gritty otherishness. And it's important for us all, people in the health professions and just all human beings, to realize that we don't need to stake ourselves against others in order to achieve our goals.
Yeah, I think going back to like the focus on medicine on a quantitative approach and hard science. I think a lot of people who would otherwise be attracted to medicine as a career have not chosen to take that path for that reason, and also the reason that you're talking about now. Like they're not, when I was a student at UC Berkeley, there was kind of a running joke that if the libraries would close at 2 a.m. and they'd have to like physically remove the pre-med majors because
Oh, yeah.
if they didn't, they would just stay there all night. I mean, actually, I think the library was open 24 hours when I first went there, and then they changed the rule because the pre-med students were staying in the freaking library all night long. And so I think a lot of people who otherwise would make excellent physicians or healthcare practitioners, nurse practitioners, nurses, whatever, what have you, are not pursuing medicine for this reason. And it's a shame because we lose a lot of potentially amazing clinicians that way.
And it's really a shame when folks even get there and then they are like, this is just not me. Like, I've had to change myself and had to like bend my values to be, to get here. Now I'm in debt because I chose to go to medical school and I don't even want to do this anymore. This just doesn't even feel authentic. And one of my a big focus of my work is helping people not get to that point, like helping people connect with their purpose and that leads us to meaning, like their reason for being, their reason for going into this work in the first place. Because it's just so easy through the process to get bogged down by the competition and the cutthroatness, and we can really lose ourselves in service of, achieving our own goals.
Yeah, absolutely. All right. So we are at M.
Yeah. So meaning and purpose, which is, probably just like the biggest, most broad topic. And it's really about just connecting with our why, throughout our training and in the day-to-day slog of what we do as doctors, as humans, in any job. It can be really easy to lose sight of the why we're there in the first place and how the day-to-day tasks really connect with our overarching values and our reason for being. And I love the Japanese concept of ikigai that comes from, I believe it's central in Okinawa, Japan, which is one of the blue zones that has been studied as where human beings live the longest and are the most well on the planet. And it's this idea that it's the ikigai, the reason you wake up in the morning, your reason for being. And it's this nexus of what we like to do, what we're good, what we like and what we love, what we're good at, what the world needs, and what we can be paid for. And it's, if you think of like a four-way Venn diagram, the ikigai, or reason for being, is at the center of that. And we recognize it's an evolving concept for us over the course of our life. But with your ikigai, we never want to retire. So I've read that in Okinawa, Japan, and I've never actually been there. I've been to Japan, but not to Okinawa, that retirement isn't even in the paradigm. Like there's, people are so active and engaged in their ikigai, whether it's fishing or teaching or karate and martial arts, that people are doing these things literally until they can't move anymore, until they can no longer, because it is their reason for being, rather than, going through your career and just saying, oh, I can't wait one more year until retirement. And of course, our ikigai doesn't have to be our profession or our job. We do just spend so many waking hours doing our jobs that it would be really great if we could connect with one part of our ikigai and what we're doing. And I do think for me, positive medicine and psychiatry is totally a part of my ikigai. And it's about helping people make decisions, helping my trainees and clinicians make decisions in their lives that put their values and their ikigai at the center of how they spend their days.
Yeah, I think that's so important. I mean, for retirement is such a bizarre concept. I think it only really fits in a society where people are doing work that's not meaningful to them. Right. Certainly I can imagine financial independence as a concept where you no longer have to work for money and you just get to choose the kind of work you want to do independent of that consideration. But like the idea of just, the last 30, 10, 20, 30 years of your life on a lounge chair or, sitting and watching TV or whatever retirement looks like for people has always been kind of nonsensical to me, and actually a sign of the profound kind of sense of disconnection and disengagement that a lot of us suffer from.
Absolutely. And retirement is one of the scariest words for physicians, because it does mean you're losing your salary, but you're also losing the livelihood that the day-to-day life, the practice, the meaning that you've built for so many years. And of course, we can't necessarily do surgery when we're 90 years old. But I will say I've been so inspired, in grand rounds, when I see all of these older, mostly gentlemen, because they're, by the, folks who are, 80 and 90 years old now. There were not many women in medicine then, but who come to grand rounds and who volunteer as, voluntary faculty to teach and to bestow knowledge and wisdom on medical students and junior faculty. I think, there's so much opportunity to keep our, older, more senior generation of clinicians around to just bestow wisdom. And even if they're not operating anymore, or not seeing patients anymore, they're the way we treat our elderly and aging older adults in this country is just really it's really inhuman. And we should be helping folks stay connected to their passions and what they did in their livelihoods, rather than forcing them out. And so yeah, I think connecting with that, and just knowing why we're doing what we're doing, thinking about what our values are, and really asking ourselves, like, what do I care about most in this world, and how does that actually show up in my life? Like, literally in the things that I'm doing, the people I'm surrounded by.
Yeah, I agree. All right, last one.
Yeah, so positive emotions. Such an interesting note to end on, because I know you had SBK on the show. He talked about transcendence as this emergent phenomenon that happens when we are integrated with our more basic needs of security and growth. And I extend that idea of an emergent phenomenon to positive emotions to some degree, because when we're living a life filled with meaning, and we're living a life in relationship with people we love, positive emotions are a natural, they result from those things. So that's where we experience love, and that's where we experience joy. And when we're in flow, that's where we experience interest and humor. So I think that positive emotions are both something that emerge, and we can learn how to prolong and deepen them through the process of savoring, through practicing gratitude, and really learning how to notice and enhance them. Because, as you well know, we evolved as a species that overvalued. We needed to focus on the negative in order to survive, and through the harsh conditions of our ancestors. And that left us with this vestigial negativity bias, where it's so much more salient when negative stuff happens and when things go wrong. So we really have to learn how to identify the positive things that happen and call them out, and let them sort of permeate our being. And ironically, when we chase them, sometimes it can push them away. So, when we just say, like, oh, I just want to be happy, and we just try to, live a life of pleasure, because we misunderstand what actually contributes to sustainable well-being, which is not just, buying a new car and taking it for a spin around the block, and, having sex with random people because it feels pleasurable. So when we misunderstand what happiness is as pleasure is not a bad thing. It's a beautiful thing. But if it's the only thing that we're chasing, it could really mislead us in our pursuit of happiness. So I like to think that happiness really happens when we live a life of meaning and a life of relationship and engagement and vitality. And then we also have to learn how to really prolong and deepen the other positive emotions that come up when they come up naturally in our lives.
Nice. I love that. So we only have a couple minutes left here, but I want to at least touch on this because it's one of my favorite frames and parts of Scott's book and Tedeschi's work, and which is post-traumatic growth. So we've all heard of PTSD, post-traumatic stress disorder, and it's real. It's it's been well studied, and I just want to be clear that when we talk about post-traumatic growth, we're not diminishing the reality of post-traumatic stress and the need to understand that and respond to that. And I think it is very helpful and empowering for people to be aware that growth is another potential outcome and result of trauma, not just distress and not just things getting and staying bad and over time, but that there's actually an opportunity with the right kind of attention and support for growth to be a result or an outcome of trauma. Can you talk a little bit about that?
Yeah, and I want to emphasize what you're saying and say that, post-traumatic stress disorder is also not even the opposite of post-traumatic growth, because
No.
in my own research that I've been doing at my institution on how frontline healthcare workers are faring in the wake of the pandemic, we've been studying post-traumatic growth using the short form post-traumatic growth inventory. And what we found is that one of the greatest predictors of post-traumatic growth was the presence of symptoms of post-traumatic stress disorder at the pandemic peak. So we essentially looked at post-traumatic growth, so the presence of spiritual growth and belief in new possibilities for one's life, that people developed more positive interpersonal relationships, that they were able to better use their character strengths, that they discovered new possibilities for their lives, that was one of the best predictors of all of those things, especially spiritual growth and relationship development, was the presence of some pretty distressing thoughts 7 months earlier. And this idea that, this automatic rumination of PTSD, that, the beginning, or acute stress, we should say, that when something bad happens and it starts to really enter our consciousness unwittingly, that we are thinking about it, we're ruminating about it, that when we begin to more deliberately think about those things and talk about them and digest them and process the trauma in a more deliberate rather than an automatic way, which is more associated with PTSD, that is one of the greatest predictors of growth after traumatic events. And I think the concept of post-traumatic growth is incredibly reassuring for people who suffer from trauma-related experiences and who endure traumatic events, because I do think it is a real phenomenon, and we can enhance it and we can foster it in people, and really good, psychotherapy and people just processing what has happened to them, and, sort of like avoid. One of the greatest predictors of adverse reactions to trauma is avoidance. And because when we avoid the things that make us anxious, it reinforces the fear and the trauma. So when we can, safely re-explore some of the drivers of our stress, we can learn how to process and overcome them. What's super interesting, and it's like I didn't think post-traumatic growth would be controversial, but me and Scott have been, talking about this a lot, that there are a lot of critics of post-traumatic growth now who say it's, maybe not a real thing, and, growth doesn't require suffering. And of course, growth doesn't require suffering. We can grow from the positive things that happen to us, the birth of our children and marriage and, incredible phenomena. And we can't change the fact that bad stuff happens and traumatic events happen. So, right?
I'm just kind of floored by that opposition. It's nonsensical to me, and like it's arguing against life, the experience of life. And anyone who is living life and paying attention and has experienced any kind of setback or challenge and has grown as a result of that will know just from their own experience, without any kind of academic argument, that is a valid frame and an important one. And this has also been, a big a part of many spiritual traditions, and teachers in those traditions. John Kabat-Zinn, for example, his book Full Catastrophe Living is all about that. When bad things happen, which they tend to, and sometimes really bad things happen, how do you cope with that? And not just cope, but actually how can you as you are able to navigate the pain and even trauma, the deep sadness and difficulty, distress, and everything that comes with that, how do you find the bright spots? How do you find the opportunities? How do you use those as the seeds for change and evolution? Pema Chodron, When Things Fall Apart, is another book along the same lines. And so I can't think of a more important frame for all of us in this day and age that we're living in now, right? Because COVID has been a traumatic experience for nearly everybody in some way or another. Certainly for some much more than others, but few of us have been untouched. And so we have a choice. Are we going to simply stay in the distress, or are we going to attend to that with compassion and understanding, and not, like you said, not avoid it? So I think some people tend to get confused about this discussion and assume that we're saying we should just like put a happy smile on our face and pretend that nothing happened. No, that's not at all what we're talking about here. Quite the opposite, actually, because to really be able to grow from a difficult experience, you have to fully let it in and accept it, and not submit to it, but accept it, and accept that it happened, and that it is still happening, and respond from that place. So I think that's such an important frame for people, especially in this pandemic era that we live in. And for me, it's been a major ingredient in my own health and well-being, having struggled through a very difficult, serious and complex chronic illness earlier in my life, and then using that as an opportunity and even as a springboard to do the work that I'm doing now. So it's something that's pretty close to my heart, and I'm glad to hear you talk about it.
Chosen the path of growth, and you couldn't have done a better setup for the book that Scott and I are writing on post-pandemic growth. And it really is a choice, and we have to choose that. What other choice do we have? And our goal through this book that is forthcoming is to help people figure out what that means for them, and get on the path of growth, no matter how, through the pandemic, no matter how it's affected us. You're right. No one has been unscathed from this. So tell us a little about or can you tell us about the book at this point? And then also a little about Thrive RX for the clinicians in the audience. Absolutely. So I'll start just a teaser about the book. It's a workbook. So it is an opportunity to learn about yourself and engage with your own internal dialogue and learn how to modify it. And we bring up a lot of the concepts that we've talked about today on the podcast: mindfulness, self-compassion, and character strains, a lot of the tenets of positive psychology, and bring them in a really humanistic way, not to suppress. I love that you had Robert Biswas-Diener, not to suppress the dark side, but learn how to let it in and engage it, and then tame it a little bit too. So we're in the process of writing, and it's been a really fun journey. And that's all I'll say for now on the book. And I don't know when it's coming out, but sometime in 2022, hopefully.
Yeah.
And it's been a joy to work on it with Scott, because he's amazing. And then Thrive RX. So for any clinicians on the line, listening on the line, so old school, any clinicians listening, tuning in, it is asynchronous. So you can watch these videos on your own. It's all online. Course for clinicians to learn about positive psychology, as well as principles of leadership and how to engage with folks who are in different disciplines than us, and as well as financial training and financial independence. And it's really, I collaborate with 3 other physicians, and it's really geared for, I would say, physicians, but truly anyone who is a human being who helps another person, whether you're a health coach or a RN or just a caregiver to someone else in your life. This course is, I I think it's been really fun to work on and to meet all of our students. So I'll send you the link, Chris, so that maybe we could put it in the show notes or something like that.
Absolutely. Yeah, we can do that. We've got a transcript and everything, so we can put that along with everything that we list with the show on the website.
Perfect.
Well, Jordan, thank you so much. I've really enjoyed this conversation. I love the work you're doing. Looking forward to the book. And I think it's so crucial to get this work out into the healthcare community. Like you said, it's really a disconnect when clinicians are suffering so much themselves to expect them to be able to support patients in the way that patients need to be supported. And so I think it's really important work, and your passion for it and engagement are really come across. And so I applaud what you're doing and look forward to hearing more about it in the future.
Thank you so much, Chris. And maybe in the future, we can make sure that all medical students and residents have health coaches, because I think
absolutely, we're working on it. Yeah, it's and it's because all of this shouldn't fall to the clinician. It's an unrealistic expectation, and so that there is a big role for health coaches to play in providing that kind of support to patients. So because reality is we do need physicians to focus on the stuff that they're uniquely trained to do. And that doesn't mean that there isn't a place for them to also, relate well to their patients and interact with them in a, with more of that qualitative focus. But it's true that's, there will always be, to some degree, a level of, that's never likely to be the full extent of what they do in a clinical interaction, right? They still need to do lab testing and procedures and all of that stuff. So yeah, that is the role for coaches.
I think we need you personally. Every physician, every trainee, we need you to help us so that we can do the jobs that we signed up for too.
Yes,
both
exactly.
interprofessionally and personally, I think.
Yeah, I like it. All of the above, for sure. Yeah. And probably all of the administrators in the hospital and staff in the hospital and everybody else, right? Yes. Yeah. All right. Well, thanks again, Jordan, and thanks everyone for listening. Please keep sending your questions in to chriskresser.com/podcast question, and we'll talk to you next time. That's the end of this episode of Revolution Health Radio. If you appreciate the show and want to help me create a healthier and happier world, please head over to iTunes and leave us a review. They really do make a difference. If you'd like to ask a question for me to answer on a future episode, you can do that at chriskresser.com/podcast question. You can also leave a suggestion for someone you'd like me to interview there. If you're on social media, you can follow me at twitter.com/chriskresser or facebook.com/chriskresserlac. I post a lot of articles and research that I do throughout the week there that never makes it to the blog or podcast, so it's a great way to stay abreast of the latest developments. Thanks so much for listening. Talk to you next time.